My name is Jessica Fitzmaurice,
And I'm Guadalupe Relas.
and we are performing skill number 1, hygiene.
Okay, we're gonna gather all our supplies. So we have a gown, 6 washcloths, 2 towels, a bath towel,
Bath blanket.
a pillowcase, a bed pad, a new fitted sheet, and new flat sheet,
Top sheet.
top sheet. And then we're gonna get our stuff for the bed bath, a basin, a bedpan, and our items for oral care.
As soon as we walk into a patient's room, we would wash our hands. So first, turn on the water. Make sure the water's a comfortable temperature for you. Get some soap. Lather your hands together. Clean under your nail. And sing the alphabet in your head so that you know how long you need to wash your hands for. Make sure to get everything washed. And you would rinse your hands off. Get all the soap off. Don't turn off the faucet until you dry your hands with paper towels. And then you would turn the faucet off with the paper towel and then throw your paper towel away. We would knock on the door. Hello, I am Jessica and this is my partner.
I'm Guadalupe.
Today we are going to be assisting you with a bed bath. May I ask you your name and date of birth while I look at your armband? Nice to meet you, Anita. Oh yeah, March 8th, that's coming up.
Okay, we're gonna do your bed bath. We're gonna start with your face. We have a new washcloth. Our water in our basin is at a warm temperature. We checked it with our wrist. And we're gonna start with her inner eye.
And work our way out. Change the rag by flipping it over. We're going to clean behind her ears too. And make sure to check for any rashes, anything abnormal.
And we want to make sure to get her neck. And then we will put this washcloth in the hamper and grab new ones.
Anita, we are going to wash your arm now. We're going to go distal to proximal. As that is done, we would wash her breast and her chest. So in to out. This is a great time to also look for anything abnormal in the breast area or anywhere on the body for skin tears, rashes. Wash her abdomen.
And if they were a bigger person, you would have to get under the folds.
Or sometimes lift the breast up to get under the folds.
Cover her back up. And then we will get a new washcloth and wet it. And we'll start with her legs. Start with her toes. We're always checking for pressure ulcers or anything wrong with her skin.
We would get a new wash rag and go to the peri area.
So we start from the top and slide down.
to the bottom. Make sure to get each side, and then
The
a new
flaps also.
part, and then in the middle you might have to pull it apart and get in the middle. Make sure to switch. Okay. Cover her back up. Get a new rag.
And then we'll have to have her in her Sims position on her left side so we can get her back side. Anita, we're gonna have you turn. Okay, with the new washcloth, we'll start from the inner out, make our way up. Make sure to get in all the folds and everything. And always check for any skin abnormality. And then after you clean,
Before, we would clean the back.
yes.
We would clean the back first and then go
So-
to the butt.
So with the back, we'll start from the neck and make our way down.
Okay, Anita, we're going to put you back on your back. How are you doing? Okay. At this time, we are going to change the bed sheets. Here's this. Anita, we are going to change your bed sheets.
So we'll roll everything under her and put the new one on.
Make sure to keep her covered.
We also want to put the bed pad on so we don't have to roll her again. And tuck it in as much as you can. We're going to have her lay on her back again. And then we're going to have her roll over onto the other side.
We will throw this in the hamper. Finish making the bed. Okay.
And then we'll lay her back on her back.
We would put a clean nightgown on her. And then we would put the clean blankets on. Before putting the clean blankets on, we are going to put our Ted hose on.
You want to make sure there's no wrinkles or in the Ted hose. Get them as high as you can. We got the bitch in there.
Thank you, partner. Make sure there's no wrinkle. She asked us to put her gripper socks on, so we will do that.
Okay, now we'll put the flat sheet on her.
And a new pillowcase.
Put the dirty one in the hamper. And now we're going to perform oral care. We'll get new gloves.
We would do hand hygiene before putting new gloves on. We took her dentures out and we will clean her dentures along with swab her mouth. I would open this. Anita, I'm going to swab your mouth.
Okay, with denture care, we'll do it in the sink. And in the sink, you'll have to put a napkin on the bottom so they don't break. Put toothpaste on the toothbrush and brush them as you would brush your own teeth. Make sure to get everything off it, like the glue you would use to put them on. And just brush and rinse and put them in the denture container.
Before, if we ever leave the bedside, the side rolls would of course be up. We gave Anita her dentures back. We will now cover her up with the comforter so she is comfortable.
Now we're gonna put the side rails up and position the bed to its lowest.
And then also raise her head, and before we would leave the room, we would give her her call light on her strongest side.
There's no collar, but we would.
If she were to have oxygen, we would clean underneath the oxygen and put it back on her. We would also make sure the oxygen didn't have any kinks in it. So I'm going to raise her head.
We will put her in a Fowler's position.
Sometimes too, the patients will need their feet rose a little bit to prevent swelling. Her mats are down because she's a fall risk.
And we put the bed alarm back on. Make sure the wheels are locked.
Wheels are locked. We would take off our gloves, do hand hygiene, open the curtains if that's what she wants. We would put our dirty linen into the hamper.
Make sure we take everything out of the room that we took in.
We didn't bring anything necessary in here. We use everything. Before we were to give her a bed bath, we would ask her if she needed to use the bedpan. She did not need to use the bedpan, so we did not do that.
Before we left the room, we would ask Anita if she wanted any or needed anything else.
Have a good day, Anita. It was nice to meet you. I will check on you soon. So after the bed bath, we would ask our patient if she needs deodorant. Some patients like it, some patients don't, so that's something you do want to ask. And then also, when we were going to, after we cleaned her peri area, we would change the basin of water and make it clean before we moved to the back into the bottom.